Getting an excellent patient history is the number one aspect of our job. When you're bringing your patient back from the waiting room, or maybe you went and to get them from their hospital room, or they were brought down to you from the hospital room, number one, ensure you have the correct patient. Double check that their name, their patient identifier, or their date of birth is correct. The last thing we want to do is do the wrong patient. Number two, ask them what happened. Like, what is bothering you? If they tell you it's their right hand and you have an order for their left hand, you need to go back and follow up on that. If anything helps, if they're going to be okay to move a little bit for your positions that you have to put them in. And the more that you talk to them and help them feel comfortable, the more comfortable they're going to be and be able to do the positions that you need them to do. Patient communication, patient history, that is all part of our job and some of the most important things that we can do.